Hello, RAMble. My name is Sarah Hobgood, and I'm a geriatrician at VCU, and I wanted to take the time to talk with you for just a few minutes about the importance of exercise. I wanted to remind you all why you are putting in the hard work of exercise on this cool September morning. The link between exercise and physical function is an obvious one and well known. Individuals who exercise have decreased medical conditions, and if they do have diagnoses like diabetes or hypertension, they usually are a bit easier to manage. Physical activity also decreases geriatric syndromes. These are things like falls and traumas, and ultimately will allow individuals to remain independent in their respective communities until later in life. Oftentimes, exercise allows people to maintain what we call their ADLs and their IADLs, which are activities of daily living or instrumental activities of daily living, much later than their more sedentary counterparts. What you may not know is that exercise has also been shown to help with age-related cognitive decline. So I want to be clear here, we're speaking about individuals that do not carry a diagnosis of cognitive impairment or dementia, but those that have normal cognition at that time. My patients often ask me what they can do to help maintain that cognitive function. Oftentimes we have discussions about supplements like ginseng or turmeric, or perhaps a vitamin supplementation. There's usually questions about sort of cognitive exercises, whether it's a specific program like Luminosity, or perhaps it's something more like Sudoku to keep the mind nimble. Data on these alternative therapies has yet to really show significant impact on those age-related cognitive decline. However, we do know that physical activity can help. What we need to be specific about is that it has to be a prescriptive physical exercise plan to make an impact on cognition. It's really, truly a body-mind benefit. But when I say prescriptive, what do I really mean? It doesn't mean something like light housework or even some yard work. Oftentimes people will say, well, in my job, I'm really busy and moving around a lot. And that's really not what we're talking about. We're talking about specifically setting aside time for uninterrupted, dedicated exercise. That exercise should consist of a few different components, including aerobic exercise, strength and flexibility training, as well as balance. So in general, if you're talking about prescriptive exercise and what that looks like for the general population as we age, that aerobic exercise should include activities such as brisk walking, swimming, perhaps running. Again, this depends on what your baseline functional status really is and how long you've been exercising. It's any fitness that's going to increase that heart rate for a sustained period of time. And it needs to be about a total of about 150 minutes per week. Usually we recommend to break this down into individual sessions throughout the week. So for example, you may choose to do 5 30-minute brisk walks throughout the week to kind of reach that goal. Strength exercises really are focusing on resistance training and weight training, again, thinking about bone health overall and muscle mass. And we encourage people to do this at least twice a week, focusing on major muscle groups with 10 to 15 repetitions per exercise. Again, thinking about bone health and muscle mass really as your goals for these. When you think about flexibility, oftentimes we think about yoga or Tai Chi. This can be really important as we age to maintain agility. And this should again happen at least twice a week for at least 10 minutes. If you're having specific issues with balance, I would actually recommend reaching out to your care team and talking to them about whether or not physical therapy would be helpful. There's specifically physical therapy for gait and balance training. And again, this can help decrease falls and other things that can occur. Overall, if you're looking to develop an individual short or long-term goal for exercise, I think it's helpful to go to the CDC or American College of Sports Medicine and American Heart Association websites. They have good details on exercise as we age. It's also going to be very important that you speak with your healthcare team. Please remember, though, that it's never too late to start. Benefits have been seen on cognition regardless of the time that you start. Earlier is always the better, but it's never too late. The adage, move more, sit less, is what we say at the American Geriatric Society, and I would highly encourage you to engage in exercise. Your body and mind will thank you. Have a great walk this morning and a wonderful day.